you ready to go practice. If we could do some patients or come to one of my lectures that we actually do patients, then you are. Whoop. Uh-oh. I hate that. How many has anyone here worked with acupuncturists before? No, okay. Has anyone in here?
Yeah, I did.
You have? Has anyone here been treated with acupuncture?
Yeah.
Okay. All right. I was the guy when, oh shoot, this pad, this is not the one I usually, all right, I am just going to see if I can start this thing, and the other was the result of, I'm just going to go right to it. I usually don't stop it. The ear, again, what I'm going to do here is just try to show these positions the best I can. They're fairly classical Chinese acupuncture points. The first one is, you see the cartilage that comes down in this part of the lobe. It's in the belly of that position, so right there. The second one is called point 0, and it's basically where the cartilage runs down, where it transitions into that flat area. And the third position is what we call salivary prime, which is basically the external auditory meatus, as close as you can get before you actually get into the canal at the 6 o'clock position. This is going to be difficult to show in the video, but basically as you come in the 6 o'clock position, just before you actually go into the ear. And for the camera, it's going to be easier to show this on the other hand. I'll transition over here. The last position that we're going to use is on the large intestine meridian. And the large intestine meridian starts at the ting point, which is basically right at the nail bed on the first finger, and then runs up the finger down to the belly, this depression right here, and then into the anatomical. This is called the large intestine. The position that we use is debated what can be is really the best. I was initially taught to place it right in what was called the ting position on that. I've since learned by some of the people that do this a little bit more than I do, that knowing it's as long as we place it on the meridian itself, we go up just a little bit farther. And what I've also found with Colonel Van Meter is if for her it works best that we use two positions, again, still staying on the large intestine meridian, but just a second one is just.
If you look on your finger, you kind of see a transition of skin to pad. That's right about where that large intestine meridian.
So at this point, I'd like to go ahead and start the needling process. And I'm going to probably do these a little out of order. I'll have more of a description of the exact order because there can be some importance of following the order. But for the camera and for today, we're just going to put them in what I would consider the easiest for demonstration. But I always do start with the salivary prime, again, just at the external auditory meatus, just before it goes in. And what happens here is the sheath is slightly shorter than the needle, so you can see the needle is slightly out here. And all I need to do is tap that in place. The next one is, we'll just go straight up, point 0, again placing the tube over the spot that I want to place and securing it and just tapping it in.
It's very easy.
The third one, Shin Men. I'm going to go ahead, because it is important to stay on one side. You won't be able to see this, but I'm going to go ahead and place one on her other finger here, just so she gets the benefit. And then we're going to go to the other side. I will show Just for speed here, is placed on the other hand. Again, the large intestine meridian that runs up, first position. I'm going to wait for those, because usually what we do is put all the initial ones in first, and then if it doesn't work within about 10 minutes, we're not getting good support, then we put a second needle.
So that's confusing.
So
Usually
I
I put one in each finger. She works better with two, and I just happen to know that, so I just treat her with two. Usually one is all I put in. But it's just a little farther up on that same meridian. And how I treat these people is usually it's a big room with 10, 15 people, and I just go
walking around. How painful is
this,
Colonel Animator, doing this? Not at all.
See at least 10 to 15 per hour.
So this will be the
at $200 a piece.
Do you wet the surface with alcohol?
Do not.
And just knowing,
and we'll
I have seen
talk
so
about all
many
that
times,
stuff kind of
I'm
at the
going to
end
place
here.
the second one on the large
In acupuncture, you know,
meridian,
some people do. It's unnecessary. There's been no infection ever reported with acupuncture.
And we'll get a tight shot here of the second one. Again, the protocol usually requires that if you're not getting success with just that initial
so again, this is just extra for her. It's not my typical one, but I'm using her because it does show the second position.
Now, initially, before we started, we give the patient a sugar-free candy. They use that during the procedure. It does stimulate the saliva, kind of milks the saliva a little bit, but if we were not doing the acupuncture therapy, I think the patient would actually have a hard time consuming those candies because they really don't produce enough saliva. So we'll let her sit here for about 30 minutes, and then we'll come back and see how we do.
To do one patient takes me about 30 seconds to place all the needles.
In review, prior to treatment, the patient is given a sugarless lozenge to milk the salivary glands. 3 sterile sarin or similar needles are placed in the ear bilaterally using point salivary prime, which is the 6 o'clock position just outside the external auditory canal. Shin men and point 0 as demonstrated. Next, 1 or 2 needles are placed in acupuncture points along the distal large intestine meridian as demonstrated. The first point is just proximal to the nail bed. If salivary flow is low, a second needle is placed approximately 1 centimeter proximal, staying on the large intestine meridian. Needles are not touched and left in place for approximately 20 to 30 minutes. All right, Colonel Van Meter, it's been now about a half hour. We're going to go ahead and take out the needles. Again, we may get a little bit of bleeding.
Single-use needles.
We'll have a 2x2.
Less than 10 cents a piece.
Available.
Less than $2 equipment per patient.
And kind of looking there, I don't see any. We'll go ahead and come down to
the fingers actually hurt.
This is the one.
Those are the only ones that hurt maybe a
You
little
are
bit.
diabetic.
She happens to be a diabetic, so she doesn't have a whole lot of feeling there, but hers do bleed a lot.
And I'll just give you that.
What's that? No, top to bottom.
And that one looks fine.
And we'll talk about kind of that order that I follow.
And you apply the topical to the finger?
You could use that stuff.
Okay, so we started off
before starting
with what you
IVs.
described
It's
as
unnecessary.
a 2 for saliva out of 10. We've been treating you now for a half hour, and after the treatment, how would you describe your saliva?
I'd say probably 7 right now.
And that's been pretty
Half hour
typical
later.
of how we've been treating. You've been usually going between a 2 or a 3 up to about a 7. And that's pretty good considering we're doing this with all these cameras around us. So again, I want to thank you for coming out today. I'll take these things here, make sure we're not bleeding anymore, and I think that's it. Okay, so for the last few moments, we've seen 2 of my patients we've treated, both with totally different conditions. one that had a cancer that was treated with chemotherapy and radiation, another one due to a surgical procedure which basically shut down his salivary glands. In a matter of moments, we were able to treat these people with a very, very simple procedure. And this is not, it's truly not Meridian acupuncture. I believe what I am stimulating here is the parasympathetic nerves to increase stimulation to the salivary glands. It does not take any additional training beyond just learning where these positions are, learning how to easily tap them in, being able to select the proper patients that may benefit, and probably just giving this thing a try. I would encourage you, after watching this video, that you would look for patients or look for people in your local area that may be providing this procedure. There are a lot of acupuncturists that may not even know about this. I can easily provide you scores of peer-reviewed literature that will show the success rate of using this procedure. I would encourage you to take this to your practice, to get this out to our patients that really need it. This was my goal by developing this video. And I would very willingly answer any questions and come out and demonstrate this to anyone that would like me to do that for your patients. I thank you.
Okay, so there is a little bit of an order to it. This contact information is not correct because I've just moved to California. So actually I'm amongst friends now in North